Thanks for joining, guys. My cloud doesn't allow me to record more than this, so it gets automatically off. But yeah, so now you're welcome back to John. Let us continue our discussion. So basically, what you have to understand is, we were talking about patient safety. We were talking about the legal rights. So make sure that if it is not given there, this person has got the legal rights to talk about the patient. You have to make sure, do you have the legal rights to talk about Emma? He will say yes. Okay. So this is the niche that you have to understand. If you don't ask the question, then they will fail you in the patient safety. At the same time, if you don't ask about allergy, again, they will fail you the patient safety. So whenever an angry patient comes or an angry partner comes, first of all, offer them a seat. Please take your seat. Have this glass of water. I'm sorry. I'm seeing you in a very difficult situation. Please accept my apologies. Okay, first of all, apologize for whatever's happened. Just say that I'm sorry to see you in this difficult situation. I'm very sorry to say that Emma has undergone a complication during the procedure. So she has undergone a bowel injury, but thankfully it was recognized immediately by the team, and senior team members, including the consultants, were invited to the theater. The bowel surgeons came to the theater, and the injury was repaired. So Emma is doing, at the moment, her condition is stable in the ICU, and I will liaise with the ICU team, and I will let you know when you can see her as soon as possible. So first of all, before they come with their anger and their upset, you offer them all this and pacify them. That's how you will approach this task. Yes, I know, Noha, you told everything in bits and pieces, but I want you to tell everything in a very coherent way, in a single flow of sentences, so that the patient's partner is pacified, so that the man is pacified, and then he will come up. Okay. So don't allow him to keep on bombarding you with questions. Maybe if you had offered me in the beginning, then I would have been little cool and communicating with him. Okay. And yes, you have to say that there's having a bowel perforation is around, it's a very uncommon thing. However, it has got a occurrence of 1 to 2 in 1,000 procedures. Okay, and we are very sorry that has occurred. So we have raised an incident report, and we will be looking into the matters, and the risk management team will be looking into the issues, and we'll be very open, honest, and transparent in giving the feedback to you, and we'll be sending the letters to you. Okay, that's very important. And also, he was telling about exams and everything. So offer her sick note. Say, offer her sick note for 3 weeks or 4 weeks. Yeah, she has to recover and go back to the internet. So all these small little things are very, very important, and all this is a point for you to score the exam. Okay. And when he asks about what time she'll be coming back, then you say, at the moment, I'm sorry, I'm not in a position to answer your question. However, I will contact the ICU team, or I will liaise with the ICU team and let you know when she will be brought back to the when should be brought back to the ward. That is from the ICU. Okay. That's very important. And the follow-up also will be arranged for her in 6 weeks or 12 weeks, according to whatever the bowel surgeons are telling. Okay. That's again very, very important. When you do a procedure, whenever you take a consent, you always talk about bowel injury, bladder injury, isn't it, Susan? Sorry, isn't it, Noha?
Yes.
Yes. So, but don't mention that. Oh, we have already mentioned in the consent form, so you have to accept. So don't mention such things. It's very dangerous. They'll fail you. Yeah. So they are knowing it, they do consent it, but still when it happens, naturally they become emotional, they become upset, they become angry, they do all these things. And whenever they ask you about offering, saying about complaint and everything, don't hesitate to give the contact details of pals. Okay. Don't try to defend. That's very important. Also, two things to be understanding. Always, you will be a part of the team who has treated the patient. That is how you are doing the debrief. You're not the person who just read the notes, even if it is practically happening. It is always the duty of the consultant or the concerned doctor who has treated or done the procedure to come and talk to the patient's partner. Okay, it is not some third person doctor who's just reading the notes and telling. That's very, very, very important. Or even if you're the one who is telling it, you should always say that, yes, you can say that I'm one of the team members who treated your part, or I can also say that I'm not the one who is involved. However, that's something nice to hear, but let us mute your mics. Thank you so much. That's for the benefit of everybody. Thank you. Right. So yeah. So you can also say that it is like it's a confidential thing that any person who just cannot, or any doctor cannot just read through the notes. You should be a part of the team, or you should be the doctor who has done the procedure. That's very important. If you had done the procedure and the complication is occurred, you have to give what is called as duty of candor. Very, very important. Duty of candor. Okay. If not, and then you have to do a reflective practice in your e-portfolio. If not, you're not the one. There are two things. First of all, you should not defend your colleague. You're saying that patients who are not competent are not allowed to enter the theater. That is a wrong statement. Anyone can come to the theater. You should say that people or doctors who are signed off their competencies are eligible to do the procedure. You have to moderate your statement, Noha.
So say signed off better than competent.
You have to say that the doctor who is performing the procedure is signed off to do the procedures, and no one who is not signed off or do not have the competency, they are not allowed to do the procedure. It is not that they're not allowed to enter the theater. That's the wrong statement. Okay. Anyone can come to the theater. Anyone can come to the theater. Anyone can enter the theater. Even F2 can enter, F1 can enter, a medical student can enter as an observer. Yeah. Anyone who is not competent can enter the theater to observe the procedure. But who is the one to do the procedure is the one who is signed off the competencies are allowed to do the procedure. So you should not say the word. You should be very careful when you say the statement. Okay. And also, don't defend your colleague. At the same time, don't put down your colleague. This is the knack. Okay. If you're the person who is involved in the treatment, or who did the bowel injury, you have to offer the duty of candor. If not, you will be the part of the team member, and you should also know I'm the part of the team who has treated your partner. However, you're the consultant and the doctor who did the procedure. They will be also coming and meeting you and debriefing about the situation. You have to give him the reassurance. Okay. You just cannot say, I've read through the notes and I'm talking. No, that's not which is happening. You should always say that I'm one of the team members, and my consultant and the doctor who did the procedure will be coming and meeting you very soon to explain and debrief about the situation. And also, never put on your colleague. Yeah, that doctor is mistake and he did. That's why your wife is suffering. That is a very, very wrong, dangerous statement. If you're going to say that, they are going to fail you. At the same time, don't defend it. No, the doctor did the procedure very well, but something went wrong. Should not defend. At the same time, you should not put on your colleague. These two things, if you do that, they will fail you. Okay?
Okay.
Yeah, that's very important. And always offer them pause. And yes, very, very, the last but not the least is very important that you have to do is offer them psychological support, offer them counselor services, because it's very traumatic for the partner and Emma. So give them counselor services, offer them psychological counseling to help, talking therapy and psychological support to help them to cope with this situation. That's very, very important. And don't forget about the counseling. Don't forget about the sick note. Okay? And
yes,
always
about the sick note.
Offer them, hang on. Always offer, at the end of everything, always offer Emma contraception at the time of discharge. So that, because the injury has occurred, yeah, so she needs some time to recover and she cannot immediately become pregnant. So always offer suitable contraception at the time of discharge to prevent any unplanned pregnancies. This is again patient safety. If you don't tell that, again, they will not pass you in your patient safety. Okay, now what's your doubt?
Even if she is going to take it, I should also offer?
What she's going to take what?
She's going to take contraception for the next 2 months.
Whatever time. 2 months or 3 months or 6 months or whatever, till they plan for the next pregnancy. Your duty to offer them eligible contraception. Offer them suitable contraception at the time of discharge. But you have to tell this in the station. Yeah?
Yes, okay. Okay. No, because when I asked about contraception, he said that we will take. She's going to take.
She's going to take, but it's again, you have to offer her suitable contraception. That's at the time of discharge, I will be offering Emma any suitable contraception of her choice to prevent unplanned pregnancies in the future. Yeah?
Okay.
That's very important. Yes. Any questions, girls, in this? Any questions in this
Yes.
scenario?
About the sick note, we does it have a frame time, or we can
You can
do
give
it?
them. You can generally we give them to 2 weeks. Sometimes you can give for 4 weeks as well. Okay. There's something called as putting things right. There's something called as putting things right. It's an information leaflet about how to make compliance and how to understand certain scenarios. And this has got some PALS details as well. There's something called as putting things right information leaflet. I'm also offering you putting things right information leaflet for your information. So you should also offer them putting things right. Okay. This is an information leaflet. When something goes wrong, you have to, this is how you will communicate with the patient. Yeah.
Okay. Yes.
Right. Any questions
Thank you.
as far as this scenario is concerned? Everybody is clear with this? All right. So when does your exam start exactly? 7th or 8th? 8th. 8th. Okay, that's good. So I am not sure whether I'll be meeting you for another free session because of lack of time and with my busy schedule. But any queries or any thing that you want to discuss with me, please do it as a voice recording and send it to me, and I shall respond to you whenever I find time, as soon as possible. Before I know, because you're in the last few days of your exam. I want to talk a bit about clinical governance, but I'm not sure whether I will be able to do today because I've got other commitments as well. So just communicate with me any queries, any doubts, anything about the exam, even let it be very silly doubt or very, very minor thing that you say that you don't want to speak to anyone. Don't feel free, because I'm a very, 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 very open-minded mentor. I would encourage people to make mistakes. I would encourage people to learn from the mistakes, because it's a study platform where you are here to improvise yourself. But if you don't utilize this platform properly, if you go to the exams and do some mistakes, there you will be assessed and you will be failed. There'll be nobody to correct you. Okay, so take this opportunity to make maximum number of mistakes. Ask many questions as possible. Learn from your mistakes. Never feel shy to present yourself. Never feel you know shy to ask your doubts or such things. Always I encourage you guys. Last but very important tip: approach each and every task with an open mind. Okay, no preconceived notions before you sit for the task. See, for example, if you're getting a task of let's say an ectopic pregnancy. Okay, so left and right and center what's an ectopic pregnancy, how you deal with that. You are very thorough in the tips of your fingers. Yeah. But as I told you in the beginning, candidates fail not because of the tough task or the difficult tasks. They fail because of the easy task. Because there is always a small niche or a small catch, a small trap for the difficult task. Sorry, for the easy tasks. And that is why I always say, wind up your task in 9 minutes, give 1 minute time for the role player or the examiner to ask the question. That 1 minute is the deciding point whether you will pass this exam or not pass this exam. Not pass the task. Okay, so that is how you should approach the tasks from this time onwards. From now onwards till your exams, the next 2 weeks, how we are going to fine tune. The exam is very important. So it's being done under time pressurized conditions. So you should be able to manage your time in a very smart way and in a very efficient way so that you'll be able to sail through smoothly. Okay. I'll tell you a simple example. A few years ago, one of the candidates had a task. It was a case of a vaginismus. Yeah. So the patient told everything about vaginismus. It's a primary vaginismus. She told everything about vaginismus, all about the psychological therapy, the lubricants, dilators, blah, 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 everything. And she finished the task in 8 minutes. So the examiner, the role player asked her, Doctor, should I do a surgery? Yeah. So the candidate said, no, no need for surgery. It's a vaginismus. So it's not necessary. So the role player asked her the second time, Doctor, do I need to do a surgery? So this candidate got a thought, oh, there's something, this is a trap. They have to understand. Then she thought for a few seconds, then she said, yes. The next time when you come, you please use all these lubricators and dilators. Because this time the role player didn't allow the candidate to exam. That's the scenario, okay? So the candidate told, the next time you use the dilators, use the lubricants, and you go for the psychological therapy, talk to the counselor and come back to me. And the next time I will give an appointment in 2 weeks' time. When you come back, please allow me to exam. Please allow me to do ultrasound. Yeah. And if I see any bridge, okay, it was a septum, vaginal septum. Yeah. So if I see something called a septum, if I confirm it by an MRI or ultrasound and MRI, then I might have to do a small operation to remove the septum. So that will improve your dyspareunia and you can have basically she came for infertility. Yeah. So when she told this, the role player smiled at her and said, thank you, doctor. Yeah. So this candidate, it was her first task. It was her first task in the whole of the exam. She passed in the very first attempt. She passed this exam. She passed in the first attempt, and this was her very first task. So that's why I always say, remember to ask. So that's remember to allow the role player to ask the question. If all other candidates out of the 14 circuit, because these candidates like I know these candidates. So out of the 14 candidates, only 2 candidates told the answer and they passed the exam. All other 10 candidates, they could not pass the exam. All other 12 candidates could not pass the exam. So that's why I always say, go with an open mind. Even if it is a very thorough task, do not overlook, do not be overconfident. Be open-minded, listen, read your task, listen to the role player, listen to the examiner. I always say, customized, tailor-made knowledge for that particular exam and what the role play asks. Okay? So if this candidate says that no, there is no operation for a vaginal vaginismus, the first time the role player asked, she said no. When the second time the role player asked, she thought for a second and she answered. When she answered this way, the role player happily said thank you, and she passed the exam with high scores. Okay, so be smart, be intelligent, use your brains. So that's why I say all healthy eating habits, healthy sleep habits. Don't study for the next just 48 hours before exam. Stop everything up. Shut down all your YouTube, Telegram, whatever study modality. Stop everything. Just completely de-stress yourself. Have a good sleep. If you're traveling to another city for the exam, make your travel arrangements properly. Pack your everything, your bag and packages and everything. Have a proper travel, a good sleep after your travel. See that you have a fresh mind, an open mind before you sit for the exam. So this is an interactive exam. This is an exam of interaction. You have to talk, you have to interact with the role player, you have to interact with the examiner, allow them to ask you questions, allow them to speak, listen to them, very important. And second thing is, this is an exam of justification. Whatever you're going to do, whatever you're going to say, you're obliged to justify to the role player, justify to the examiner. All right. Wish you all the best. If in case of any doubt, please send me a voice message or a text message. I'm happy to answer your queries for the next 2 weeks. All right. Wish you all the best. And I hope to hear from you. Good news at the end of the exam. Any questions?
Yes, ma'am. Please, can we differentiate vaginismus and the vaginal septum from the history?
Yes, you can, but if you sometimes you can't, and that's why they give you a clue at the end. And if you're able to pick up the clue,
Yeah.
you're passing. If not, you may not.
So,
So,
what
yeah,
question? Like, I feel tightness. This is vaginismus. If she is feeling like blocked, this
certain
is
things,
septal.
I'm telling you, certain things may not be very clear cut. It is always certain thing. It's always not black and white. Sometimes it is gray. So that's why I said sit with an open mind there. For example, some ectopic pregnancies, they will give you a live heartbeat. Okay, they will see you,
Yes.
this is a live ectopic pregnancy, but they give the beta HCG 3500. This is a very common recall task. Students, candidates, they see only the 3500. Oh, this is 3500. Oh, this is not above 5000. I'm going to give her a methotrexate. But with a live heartbeat, do you give methotrexate? Do you give
No,
methotrexate? What do you give? You go for
no,
a
only
salpingectomy. Yes.
surgery.
Yes.
Mm-hmm.
But students will be, that is why I say it is always customized, tailor-made knowledge. Yeah. If you just look only into the beta HCG, if you don't look the live heartbeat, you will make the mistake of saying methotrexate. Yes, which is a mistake. Yes.
Mm-hmm.
So you should be,
Yes.
certain things are not black and white. They are gray. It's not very, sometimes it may not be very clear cut. And you can never ask them why you put this task like this. You can never question the RCUG. It's you have to intelligently analyze it and make a decision and answer or ask questions or answer questions. Yeah.
Yes.
That's
Okay.
very, very important. Yeah.
Thank you. Yeah. Thank you.
Thank you. Any more questions? I'm happy to answer. Otherwise, we can wind up for the day. I will post this recording to the group so that the latecomers or those who have not participated can participate. And I encourage people to ask questions in the group or text questions, because I may not be able to individually communicate with you all except my course candidates or candidates who take my mock exams. I'll be able to communicate with them. But for the others, for my general candidates, I'm more than happy to help. But it's you who have to communicate with me, and I may not be at the back of you asking you to post tasks or asking you or giving you feedbacks, because I'm very extremely busy with my own jobs and with my teaching and everything. So I may not be at the back of you all the time. So that's why I do conduct some free sessions out of my willingness to help all of my colleagues. But it is up to you to make use of to make use of this platform for your own improvisation. And I'm 200% happy to help you all, but it's up to you to ask me to help you. If you don't ask me, I may not be, because I don't I don't have time to individually monitor, the groups or, answer to, I do have my own course candidates and my mock candidates. I do have a separate group, and I'm very busy and teaching them and clarifying their doubts and giving feedbacks. But that may not happen in a free group, or may not happen in, the general groups because of the time constraints. But I'm happy to answer anything or help you anyway, but you have to ask me. Okay. If you ask me, I'm happy to do that. Okay. Thank you so much for your joining your session and spending your valuable time. Wish you all the best for you. Thank you so much. Bye-bye.
Thank you, ma'am.